the new technology which allows the teeth to be uprighted and moved safely and effectively and in a shorter amount of time. So it is a really good idea to come along and at least have a listen. You're going to open your eyes, you're going to really see the new wave of orthodontics.
As a general dentist providing orthodontic treatment in your office, especially with Fastbraces, I think put me at a different level as compared to my other colleagues, because it definitely helps me to become a better dentist. I can treat my patients in my practice the way I want it. I can achieve better aesthetic results by including Fastbraces into my practice and incorporating it in certain cases that will give me better results at the end.
I'm practicing orthodontics as a general dentist, although I am a periodontist by education, but I've had a lot of orthodontic education along the way. And I think we're able to handle probably more than 80% of the cases that come along.
I think it's a good thing that general dentists can practice orthodontics. Again, as long as you're getting treatment done in a predictable fashion and quickly, and I think that's the benefit of Fastbraces.
Today we can treat orthodontics. Before we never did. We just refer. Now I'm not afraid. How many teeth do you have crooked? I'll fix them. It's easy.
The system is so straightforward and relatively easy to understand and implement that it really is a boon to general practitioners.
Once I started doing orthodontics, as a general dentist, my eyes were open to the whole different possibilities of how to treat a patient. So because I do it, they get their orthodontic treatment, they get it fast, and many, because of the quickness of it, many who wouldn't have done it before, they choose to do orthodontics.
A text message from a mother of my patient saying what magical thing did I use in her son, because she wants the same thing. Because they got, I think, an opinion from 3 to 5 orthodontists that the only thing they could do is surgery, upper and lower surgery, break the jaws and put all together. The kid looks amazing, she looks beautiful.
I had braces for about 4 to 5 years, and I wish I had Fastbraces because they had to pull 2 of my premolar teeth, which were perfectly fine teeth. So the fact that I can provide this service for my patients without extracting their premolars, it's phenomenal.
I thought, wow, I finally have a technique where I can finish cases. I've been doing orthodontics for 15 years in 8 different ways, and this is the first time you can actually make the teeth look the way the patients want to look at it in the mirror.
It's really expanded our services to our patients, and it's really awesome to see the changes in their smile. And it just kind of opened up a whole new chapter, a whole new area in our practice, and it's really exciting.
And when I ask my patients how much is their discomfort from 1 to 10, they tell me 1.5, 2.5. I said, you must have more pain. He said, no, I don't have, doctor. I said, oh, it's the technology, it's really good. Let's keep doing this.
To see some of the changes that have happened and just to see their reaction to it it's quite amazing to know that you can have such an effect on somebody's life.
If you're apprehensive, particularly new dentists who've never done orthodontics, he holds your hand. They make it very simple. The customer support is great. There is an amazing number of people who are floating around here in Dallas, here just to help you. So I really encourage anybody who's interested, because unfortunately for our patients, the orthodontics being done at the moment is not ideal. So I'm doing this for the better of my patients because I want to treat them in a better way.
I've been really happy with the support that Fastbraces provide for Fastbraces providers. Anytime you have a question or difficulty regarding anything, you call. There's always somebody available to answer your questions and address the issues that you have difficulty with. I've been pretty amazed by it.
I love it. Yeah, they're just very meticulous, very detail-oriented, and it really enforces doctors to be meticulous too. And the training is it's continuous. It's not a one-time training. It just keeps expanding and learning new things.
That we can review pictures and see how the teeth are moving, and if we do have a question that we don't know the answer to, it is very nice to know that there's a lifeline of somebody that can answer that question for us.
Yeah, they all know my name already. Oh, you're Dr. Shepard. I am Dr. Shepard. I'm always calling, help me, and they help me. And I feel more confident.
I've always gotten through to the person I wanted to speak to, or they got back to me very quickly with any questions I had. And you know, it's nice to know that you have a kind of a hand to hold going through the process. I mean, I'm in the midst of working my first 5 cases. As I get more experience and more knowledge, I'm sure I'll rely on the Fastbraces staff less. But it's always nice to know when you have questions that you can call and get them answered, you know, spontaneously.